Aside from skin cancer, prostate cancer is the most common cancer affecting men in the United States today, and it's the second leading cause of cancer death in men. In 2008, almost 200,000 men were diagnosed with prostate cancer. Thankfully, for most men, prostate cancer is caught early before it's spread to the other parts of the body and is therefore potentially curable with appropriate therapy. Radiation has been used for decades to treat patients with prostate cancer with a high rate of success and can be given in several different forms. One form of radiation, called radiation brachytherapy, is delivered directly to the prostate in the form of implanted radiation. At Community Hospital in Indianapolis, a form of brachytherapy called high-dose rate brachytherapy is available for patients with prostate cancer and is only available at a limited number of hospitals across the country.
The patient's brought to the operating room, placed under anesthesia. Under ultrasound guidance, the needle tracks will be placed in the prostate. Then we get a CAT scan to determine where the radiation would go. Each treatment lasts between 15 to 20 minutes. Most patients get between 2 to 6 treatments. Once the radiation is delivered, the radiation and the needle are removed. Most patients go home that same day.
HDR brachytherapy is a newer technique of treating prostate cancer that delivers a high dose of radiation directly to the prostate. Because the radiation is delivered directly inside the prostate, it limits the amount of radiation surrounding organs receive.
Most patients whose cancer has not spread can have high-dose radiation as part of their treatment. Patients in low-risk group can be treated with high-dose radiation alone.
Radiation brachytherapy for prostate cancer also comes in the form of permanent radiation seed implants. With this form of brachytherapy, small pieces of radioactive metal are directly implanted into the prostate and remain there permanently. At Community Hospital, HDR brachytherapy has replaced standard radiation seed implants for the treatment of prostate cancer.
What stands out in my mind about the Community Cancer Pavilion is the personnel and the way they treated me as not just a number, but I was a patient and I was their patient, and they wanted to take care of me.
Unlike with the traditional permanent seed implants, with high-dose rate radiation, there's no radioactivity that the patient goes home with. The radiation's removed before they go home, so there's no radioactive precautions that they have to take when they get home. In addition, because of the way we give the radiation, we can deliver the radiation much more precisely in the prostate compared to traditional permanent seed implants.
At Community Hospital of Indianapolis, you're cared for by one of the most experienced, knowledgeable cancer care teams in the area. They've been performing HDR brachytherapy for over 12 years, and they are a regional referral center for HDR brachytherapy treatment.
High-dose rate radiation offers a less invasive alternative to surgery for prostate cancer. The recovery time is shorter, and the outcomes are at least as good as with surgery. In terms of side effects, the high-dose rate radiation offers the best chance for men to preserve sexual function and maintain bladder control.
Of course, I had the high-dose radiation therapy. There were a couple of treatments that they did on me. Surprisingly, it wasn't very invasive, or it wasn't very painful at all, no pain at all whatsoever. And today I can say I feel very, very good.